Well, good evening, everyone. It is really good to have all of you here tonight, and welcome on behalf of Willow Grove United Methodist Church, if you're here with us live or if you're watching virtually. This event came about recognizing who we are as a local church, and so recognizing that we are in a unique time as a nation with the pandemic. But also, as I have prayed through our membership, but have also looked at the incredible gifts and skills, one of the things that happened in a conversation between Shirley Little and myself was the recognition that we have an incredible number of medical professionals that are a part of who we are, and really that are in so many different aspects of healthcare and nursing. And while the 5 people that we have gathered here to help bring some information to you and to answer questions, and to do that not only from their expertise, but also from their heart and their love and their care for you. There are many, many others as well. We have a number of other people. I see that Cheryl Del Sordo is on. She's definitely one of them. Debbie Grutzmacher has been a regular attender and an asset to us as a congregation. So there's a number of other people. But at this time, without much further ado, I would like to introduce Abby Donnelly, Ed Donnelly, Christine Weller, Deb Pranzato, and Sue Mathers. And I am going to turn it over to Abby. And I'm going to do my best to spotlight each person kind of as they're speaking, so you're able to see them better and more clearly. So here you go, Abby.
Okay. Good evening. It is an honor and a privilege speaking with you all tonight actually. On behalf of the panel members, the Willow Grove United Methodist Church, and the Reverend Lorelei Toombs, we welcome you to this informational session about COVID-19, the pandemic that has ensued, and what hopefully can be some learning and information passed to you that will help you make really informed and good, knowledgeable decisions about your healthcare and those of the people you love and your family and friends and so forth. The panel members represent many decades. I hate to say that, guys, but many decades of diverse education, professional training, clinical knowledge and experience. There is a wealth of information and learning that is going to be made available to you this evening. We wanted, though, make absolutely clear that this is not going to be a session which will tell you which COVID-19 vaccine to purchase or get, or a particular time frame to make sure that you comply with that. This is not endorsing any product at all, but rather providing a really good general baseline of information that you can have really good conversations with your primary care physician, your family practice physician, other healthcare professionals. Maybe it's via telemedicine, but you can certainly question and have a good conversation of what you need to accomplish in order to stay safe moving forward. I would suggest that you might want to jot down questions as they come to mind. If something is said that you want to further delve into, jot it down or use the chat feature. We have a number of folks that can kind of help us keep track of that. So we want to make sure that everyone leaves here this evening feeling informed and confident about moving forward in this very uncertain time. The basic knowledge, we are going to basically go into some types of vaccines, what is on the horizon, what is being tested now as we speak, what is that testing process, what is the method that is used that has been tried and true in the past. Ed's going to speak to that, my husband, and I want to tell you a little bit more about the individual panelists before we get on much more with the program. Ed Donnelly is a clinical pharmacist. He has been in the community for decades. He is the best pharmacist I know, and I can even say that. He is my husband and my soulmate, but I even said that before I married him. So he is a great resource. Please feel free to reach out to him. We have Christine Weller, who is a master's prepared registered nurse who works in acute care at Abington Hospital. So she has been in the throes of this epidemic now for how many months? 5 months, Christine, so God bless you. We have Deborah Pranzato, who is a physical therapist, who has had many different roles in outpatient setting, rehab, now home care, in both care delivery and in management level positions. So she can speak with great authority. There's also Susan Mathers, again, a master's prepared nurse who is a certified school nurse and is still practicing and is local in the Upper Moreland School District. So her expertise is pediatrics, which would be the care and delivery of kids, children, and youth, and all the way up to seniors in high school. So as you can see, there is a wide depth and breadth. I'm last and hopefully least, also a master's prepared nurse, and most significantly a nurse educator. Currently retired, but most recently teaching at Westchester University. So we're hoping that you're going to get an earful tonight and feel really comfortable and confident in asking questions of us so that we can prepare you to ask those questions to your physician as things evolve, as we begin to manage COVID better than it has been managing us. I'd like to turn it over now to Ed Donnelly, and he's going to talk about the types of vaccines. He's going to talk about the testing methodology that's in place. There'll be a great amount of information that he's going to paraphrase, but you might hear some things that you'll want to follow up with later in the program. Ed?
Okay, can everybody hear me okay? Coming through? Sounds good. Okay, very good. Hi and good evening. I'm going to cover a bit of information in regards to the testing for COVID and also getting into vaccines and what we have on the horizon, and a little bit of history and some information in regards to what we can do right now to make sure we stay healthy until the vaccine is available. I'm sure there's going to be more information as we go along. But just a quick one on the testing. You'll hear testing all over the news. There are really two types of tests that are being run right now. The one type of test is a viral test. That's the one you'll probably have seen on TV, where they seem to be sticking that Q-tip as far down or up your nose as you possibly can. Does not look all that comfortable, but it is an accurate test for the ones that they are using. And it's a viral test. Now, what that means is that with that test, we can get a reading, depending upon what system they're using, almost as quick as 5 minutes. It may take a day. It just depends upon volume and what is all in place. But that test is telling you whether you have the disease right now. So if you were to pull up to one of these, and these are the ones that are being done at those free sites, we can, if you don't already have the symptoms, if we're not sitting there with a cough and feeling totally wiped and such on down, really what that's going to do is tell us if we are possibly a carrier. And if we are with active test at this moment, or active virus. Those tests are growing as we speak. They're the ones that everybody is trying to get to. We do the nasal swab. They've gotten one now where you spit into the tube, and there's actually, within the last month or so, an approved one by FDA for home use, which you'll hear more information coming out. It's more or less licking a piece of paper and sticking it into a sealed tube and sending it out. All hopes is that you would have an answer within 7 to 10 working days. Of course, a lot of people that are healthier by that time will probably be feeling a lot better anyway. So testing is so important because it lets us know where the hot spots are. It lets us know where we have to concentrate on care at that moment. It lets the counties and the state and the federal governments know where we need to move the resources as quickly as possible. The other test is an antibody test. Now that is going to require a little bit of blood. So that's something that's not going to be done at a drive-up site. That's something that more or less will be done in a doctor's office or in a lab, where the results would then be sent out and you would have the results in about 3 days. Some of them are as fast as a day. But once again, this all depends upon where you go and how important it is to look at these tests. Now, an antibody test tells us whether we've had the disease or not. It can tell us if we're active at this particular moment, but the use of that antibody test is for that somebody who may have come in contact with people who have the COVID virus or have had the COVID virus or have it, and whether or not you have antibodies to protect you about it. And that protection can also lead into other situations where you'll hear in the news about people donating plasma that have a positive antibody that we might be able to use in patients who are having a severe episode of COVID-19. So testing is important. And as always, we hear the free testing. Well, let's get a little clarification on the free testing. For the majority of these test sites, it is free. It's being funded by state or county or federal money. The thing is that it's free if we have nobody else to bill. So when you see places like CVS's Minute Clinic or some of these drive-in sites that you can be tested, they'll usually ask you if you do have an insurance coverage to see if they could bill your insurance for this. And most insurance companies are accepting this bill very happily and paying it in full. But you do want to be aware that you may get some paperwork in regards to that. The other thing is that most of these sites are going to say call ahead. You can go online, check your local health departments, check the state sites. Make sure you look at the dates of the sites that you're on. I would love to say the internet is great in getting rid of old information, but just today I clicked on a couple sites and I looked at the latest information was dated March 17th. A little old, has been updated since then, so you do have to look at these sites. On a little side note, when you do look at internet sites, I used to tell this to all my pharmacy students and all my patients. You're going to see .gov, .com, .org. .gov is going to be a government-run, information only. We have no reason to advertise anything in particular other than to give you the information. .com is a commercial site, and right there will tell you exactly what's going to go on. It's going to be commercial. My product is better than their product. .org is good and bad. We have groups like Willow Grove and United Methodist Church.org. We're a good organization. But we'll also have places like Safe Pharmaceutical Care, which is sponsored by the Pharmaceutical Manufacturers Association, which is giving you information but may be slightly slanted. So .gov or .edu, .education, are usually going to be your best sites. A little bit on vaccines. We have a lot of vaccines already on the market for various conditions. the flu vaccine we hear every single year. Vaccines are either going to be live or dead. And by dead, what we're doing is we're killing off a virus or a small piece, and it's still bringing on a response in your immune system. So vaccines are so important, and especially right now, being up to date on your vaccines. We have a pandemic. This is a big deal. There's a lot going on. If we can keep you healthy on everything else, if we can get your vaccinations up to date and keep you as healthy as we possibly can, then we have less to worry about. And if you do go to your local pharmacy, especially the chain pharmacies right now, CVS, Walgreens, Rite Aid, you'll find out that you're probably being asked if you'd like to be up to date on your vaccines. Some of these companies have actually contracted with insurance companies and Medicare that they're actually getting messages saying, hey, Mrs. Smith's in your store today, and we noticed that she has not received her pneumonia shot. So please ask her if she'd like it. If she doesn't want to do it there in the pharmacy, please ask her to contact her physician and set up an appointment so that they can get everything up to date. With that, we have COVID vaccines. There are, let me look on my notes real quick, 42 COVID vaccines now in research that we are aware of. Out of this, 6 of them are in what they call phase 2 and 3. So what are these great phases? Well, phase 1 is just coming up with what we're looking at. How can we make this? How can we do this? We get into other phases. Let me grab my notes real fast because I don't want to misspeak. So phase 1, we want to find out what we can do with a vaccine and if it's going to be safe. And safe, we can very well come up with great things, but if the cure is worse than the disease, it's not useful. So that's going to be phase 1. Phase 2, we start actually testing to see how safe and somewhat how effective this is. Phase 3 is a great phase. Phase 3 means that we have gotten enough information on safety that we can start testing this on thousands of people. And of course, the more, the better. But in testing, we need to have some time gone through and some situations happen. So this phase 3 testing can last 6 months, 8 months, 12 months, because we need to have as much information as possible to make sure that it's going to be as effective as possible. So the more situations we can do and the more people that we can get into these trials, the better off we're going to be. Phase 4 is actually, we've gotten it approved. We've gotten it manufactured. We've gotten it distributed. We have now into the situation of who we're going to get it to first. And of course, we want those that are going to be caring for sick people to be on that top of the list. And so there's that pecking order that's going to be of who's going to get that vaccine first and how we're going to distribute it. A couple of bits of information on this is distribution was just covered today. Dr. Fauci did do an interview, and it was one of the questions that came up. The United States has a plan for distribution. Exactly how that plan is going to work is, yes, we need to treat our front line, our healthcare professionals, those that are coming in contact with patients that have active disease. We're going to make it available to them first. and then we're going to distribute throughout the United States. Since the government has actually funded a couple of these in what they call fast track into getting them onto the market, there will be a fair number of free vaccines when they do become available. Now, the availability, another question involved. There is a quote from Princess Bride, a movie that I truly love, by Miracle Max. And his quote is, "The problem of rushing miracles is you end up with bad miracles." So we need to let the research take its course. If we rush things, we have a very good chance of making things worse. But with that said, we don't have to go quietly into this mystery. We can make sure that we keep ourselves as healthy as we possibly can, follow the guidelines that are out there, and when these do become available, take advantage of it. Yes, with every vaccine, there is a certain amount of risk. The biggest amount of risk is that your arm is going to hurt a little while. For those that don't want them in the arm, your doctor's office could probably use other muscle masses, but most commonly, the arm is the most convenient. So other than a bit of soreness, maybe a little discomfort, at the worst, maybe a bit of fever, that is the majority. Is there going to be other potential side effects? We know everybody reacts differently to many different things. We have to be aware of allergies and sensitivities. But with that said, when it becomes available, we will be informed as a country. We'll be available, and the care will be there for what we need to do. With that, I will turn it back over to Abby and look forward for any questions that you may have at the end.
Okay, I think I got you unmuted.
There we go.
Yep.
Sorry about that. Just one follow-up to that. Thank you, Ed, by the way, that was really good. There's going to be ongoing surveillance, whatever this vaccine will look like. There's going to be ongoing monitoring and surveillance indefinitely to be able to isolate any side effects that make themselves known over time. It's important for people to know that the United States and its immunization plan is still probably the best on the planet. So again, that kind of reinforces the idea with science and good, solid resources, we're going to be in good hands. It's just going to take a little time to get there. So on that note, we're going to turn to one of the critical things that has evolved out of this pandemic is the fact that school-age children, and Ed alluded to this, also seniors, are two vulnerable age groups when it comes to COVID and mortality and morbidity once the disease is contracted. So it's important to note that people are falling behind the recommended schedule of vaccines. Sue Mathers is going to talk about that in depth with kids, but also seniors and adults need to pay attention to that as well. Because as Ed said very adeptly, we can't afford to be worn down and sick with other things that we can manage until we can thoroughly manage the COVID-19 virus. So, Sue, on that note, would you like to continue with your pediatric focus or children's focus?
So I'm not sure Lorelai's going to play the video, but one of the things, Lorelai, are you going to play the video or do you want me to go ahead and talk live? Well, I will go ahead.
To talk live, you can go right ahead, but I
Okay.
can, yep, go ahead.
I'll talk live. One of the things that is important right now as we leave July and move into August is the process of thinking about, is it safe for kids and adult staff to go back to school and be in the school building? If you think about your local child's school and classroom, there's easily 28 or so, maybe 30, maybe only 24, 25 students in a class. That's not a big room. They're close together. They're certainly not 6 feet apart, maybe 3 or 4 feet apart. In the Upper Moreland High School, there's 1,000 students, and there's about 700, 600 in each of the other buildings in the district. We know that the safety and the ability to protect yourself or protect others is by wearing a mask. Trying not to touch things in public, use hand sanitizer, wash your hands, not touch your mouth, your face, your nose, your eyes when you are out. But as the local districts start to plan to head back to school, it's a big concern that students and staff, the adults, whether they're young adults teaching, middle-aged adults, or older adults, are going to be exposed or expose others if you don't have symptoms. If you're that kind of middle 30 to maybe 40-year-old, even some of the 20-year-olds that don't have symptoms, and you are now going around and spreading it possibly, or exposing others to the possible spread without even knowing it. We talked last week, Abby and Lorelei and I, and at that time we did not know if our local public school is going back into the building in the fall. We did know that Philadelphia is not, Norristown is not, Upper Dublin is not. I did just hear over the weekend after a school board meeting on Thursday night that Upper Moreland is not going back into the school building. They will be doing an online school through the district, which will be much more rigorous, I'm told, than what occurred in the spring when we were all trying to get acclimated to it quick and figure it out, keep students engaged, and continue to have some learning and some reinforcement of learning that was done throughout the school year prior to shutting down in March. I think one of the big concerns that school nurses have is we do have students that have a compromised immune system. Mm-hmm. When you think about high schoolers or even elementary school kids, you don't really think that there's too much compromised or chronic illness, but you do have to think about the students that have diabetes. We have several in the high school. We have several in the other buildings. The students that have asthma, this can be quite frightening when you hear the numbers of older adults or adults and children that now you've got trouble breathing on top of you've already got asthma. It can be very frightening to think about getting COVID-19. We have students that just in general have a compromised immune system from birth. There's no explanation, and they see maybe an immunologist regularly or an endocrinologist. There are many other conditions that can compromise a young person's immune system. So that's a very scary time for parents to think about sending their child back to school. If you look at the other end of the spectrum, some of the young people or the youngest and the teenagers don't often show symptoms. Now they're maybe getting exposed, maybe getting COVID, not knowing it, not having symptoms, taking it home to parents. As a grown parent myself, I help out with some elderly people in our neighborhood, and as well as try and keep in contact with my mom at a retirement community. But think about young adults or middle-aged adults who are shopping for their parents, who they're not going out or they don't get out well. And those kinds of exposure things that do affect families in general, not just children, but then their parents and then their grandparents. So it is a concerning time. I do know that through my professional organizations, a lot of the nurses are describing difficulty getting PPE. And so you've heard it enough in the TV channels and the news, the personal protective equipment. It would be a face shield, maybe goggles, masks, gowns. I really thought twice about, well, if we go back into the building, what would I wear? I have no gowns. I have no face shields. I have no mouth coverings at school. We don't typically keep masks at school. To my knowledge, in the past 23 years, I've not really had to concern myself with a virus or a bacterial infection that wasn't, I want to say easily contained, but contained enough in knowing to wash my hands, not touch my skin, wear gloves when I'm working with a student who might possibly be susceptible or carrying something. We get them out right away, home to their parents or to their physician or the ER if it's a very concerning acute symptoms. One of the things that we also talked about last week as panel members was Upper Moreland has put out, and I know other school districts have done the same, that parents need to be aware if their children go back into school and they are running a fever and the school nurse calls and says, you must come pick up your child. You have 30 minutes. They don't want the student in the building any longer. They want them out of the building and either home or getting, sent to their family doctor or their acute care setting if the symptoms are severe enough. Many of our parents can't possibly get out of their office and to the high school or any of the other buildings in Upper Moreland in 30 minutes. We have many parents that work in the city or work out in King of Prussia. And so that's a concern. How are parents going to manage this? Now, again, I did just hear that Upper Moreland is not going back, but we're still looking at one semester, maybe Thanksgiving, maybe Christmas. We've not gotten a definitive answer on that yet, but we still have a long way to go. Ed talked about the vaccines that are in the process. So we really don't know as healthcare providers, when is it going to be safe to have patients back in our offices or see students? My concern for teachers was if we went, kids went Monday and Wednesday, a partial, and then the other half of the building went Tuesday and Thursday. That was great. The teachers and the staff saw half the kids, but yet I was going to still be seeing sick kids one after the other. So I was going to be exposed to basically the sickest of the kids that are in the building. Whether they had COVID or not, I wouldn't know. There'd be no tests that I could do in my office. And then I am also of that age that was a little bit concerned. I'm not fearful, but a little bit concerned. So some of those items have been waylaid, and we now understand that students, for the most part, in most of our area, will be going to school online. And that brings another whole subject up of, continued cognitive development and growth in education. Some special ed students that have IEPs or 504s need extra help, need extra care, need extra attention during the day. Some have one-on-ones, some have smaller classrooms with a more personal aid or a teacher's aide in the classroom to help with learning and focus and attention. So this is really going to affect many, many students in the continued growth and development, emotional development, socialization, which for high school students is so important, and the continued education of young people who may be getting COVID-19, not knowing it, not showing symptoms, but helping them to understand that it's still really, really, really important to do the things that our healthcare experts are telling us. Stay 6 feet apart, wear a mask when you're in public, do just small group gatherings, increase your bubble, as they say, by maybe just one or two friends and maybe your relatives, aunts and uncles and cousins, not just go out and go back to doing your same old thing. I was watching the news tonight earlier when I was eating dinner, and there was a story on about a high school student. He's a football player, a wonderful student in high school. I do believe they said a senior. He had been going to football practice. They'd been practicing. doing their distancing in sports, which is also a very big concern for me, is these athletic practices going on now. He and his mom and his dad all contracted COVID. His mom and his dad have passed away. He's a high school senior and was practicing for football. I just can't even imagine, what do we do next? And then what kind of environment are we putting our kids and our staff in that we're just really not sure? And that's the hard part. We're really just not sure. One of the few other things that Abby and I talked about was we're finding in my professional organization, Montgomery County School Nurse Association, as well as the American Academy of Pediatrics, that children up till 18 years old, adolescents, are falling behind on their regular immunizations. We have lots of immunizations that are due from kindergarten through 18, including your senior year. You have meningococcal vaccine due to protect you from meningitis. And those they're falling behind the regularly scheduled timeframes because there's so few doctor's offices open. There's so few parents making appointments because they're saying, well, we're not seeing anybody in the office, or this is telemedicine. Or if it's something acute and severe, like maybe you're having breathing symptoms, or maybe you've got a headache and a sore throat, they're asking you to go get tested. So we really do need to be concerned about the immunization schedule and young people falling behind, as well as adults. If you've got young grandchildren, you may have been asked by your son or daughter-in-law that you need to go get a vaccine for whooping cough, pertussis, if they have a new baby in the family and you are going to be spending any time around them. Pertussis can be spread by adults to babies who don't have much of an immune system developed yet as infants. So there's a lot of fallout from COVID-19 and the shutdown and the change in how we see physicians, healthcare providers, and how it will affect all of us eventually.
Thank you so much, Sue. I know that we really want to be sure that we get and turn over to Deb and to Christine, but I know that one other thing that you spoke to us about that I think it would be good for people to hear was you spoke specifically about your personal experience of nursing over the last 20 years and what a significant difference you saw that influenza, especially the H1N1. And I just wondered if that really bears repeating.
Sure. I can go back through that. I'll do it briefly. So one of the questions we talked about when we discussed as panel members earlier, because I thought I'd still be on vacation, was is the American Academy of Pediatrics, or in general, your family physician, your child's healthcare provider, whether it's a nurse practitioner or a physician, are they recommending the flu vaccine? And what I do know is that at this point, certainly particular to your child, check with their healthcare provider, the flu vaccine is still recommended. There is no change in how that is proceeding. While it's a virus, it's different from the COVID-19 virus. And we want to make sure that you continue to protect yourself from influenza, because the last thing any one of us wants is to get influenza and then be exposed to COVID. And it's just a double whammy that I don't think any of us want to go there and experience that. Both have similar symptoms, but we certainly know that influenza is very dangerous to young people who do not have a fully developed immune system. And then it's also dangerous to older people who also have less of a response to viruses that the younger generation can kind of wing through. And I will tell you that my husband was in the hospital for a minor heart attack. And we had both gotten the flu vaccine. He knew he was having some surgery. Didn't know about the heart attack, but it happened, and he did well afterwards. And we both wanted to just get out of the hospital real quick to get him back to some rehab he was doing for an orthopedic surgery. And a couple days after we got out of the hospital, we both were hit with a flu. While we had the flu vaccine, it was maybe just a different strain. But we were so sick, both of us, like on the couch for a week. We were knocked on our butts. And I thought, I'm never going to believe another person who says, oh, I don't get the flu vaccine because I get sick from it. You know, it might get a sore arm, a little scratchy throat, or a little cough, or a cold for a day or two, but you do not want the flu. And you certainly don't in this season of life with COVID-19. You certainly don't want both. So follow up with your healthcare practitioner, because some people have conditions where they should not get it, or they need to get a certain one. There's a nasal spray or an injection, but follow up. You should still be recommended to get a flu vaccine. As a nurse in the school district the past 23 years, I have seen a significant change from December when kids come back from school, well, January, when they come back to school from holiday vacation. I have seen a significant decrease in the number of kids that are ill and visiting the nurse, because the flu vaccine is now recommended to everybody, not just the younger, the less, or the immunocompromised and the older people. It's recommended to everybody to get it. And if I had the time and the energy to do a research project on it, I would, through the school nurse system. But it's a significant decrease in illness and students coming to the nurse's office with cough, cold, sore throat, don't feel well, headache, and fevers. So I'm a firm believer, get your flu vaccine this year.
Thank you so much, Sue. I'm going to turn it back over to you, Abby, and then you can keep us moving.
Yep. We're going to talk now, Deb and Christine are going to talk about the community response to COVID. And again, with the goal being, how can we manage COVID better than it is managing us right now? And so they're going to speak about some things that you've probably heard time and time again, but I want you to hear it again and kind of tune it in as a fresh look. And Christine, if you wouldn't mind going over like how to wash your hands, like minimum of 20 seconds, sing happy birthday twice, you know, whatever it takes. Take it away, guys.
Okay, so my name is Deb Pranzato, and I'm going to talk a little bit first about general community mitigation, and then Christine is going to be following up with some more details. So community mitigation is just a fancy way of saying, what are we going to do to slow this down? What are we going to do to lessen the impact of COVID? And, you know, I think sometimes we're in information overload with what's out there, and some of it's political rhetoric, but there are some very basic things that we can all do. Again, Christine's going to go through some of the nitty-gritty things like face coverings and hand washing and things like that. But some of the general things that we all heard about in the early days for community mitigation were things like we were in the red zone, or now we're in the yellow zone. And really it talked about how much people were out and about in the community. So schools closed and went to online learning. A lot of workplaces shifted and encouraged everybody to work remote wherever possible. We certainly saw the impact with retail businesses, many being closed, restaurants doing takeout only. So there were many, many, many things that have happened, and different parts of the country are at different levels with reopening. But I first want to say that in the midst of all of the mitigation and things being closed and people socially distancing and trying to stay home, one of the concerns that I've seen in healthcare, and right now I work predominantly in home health, is that a lot of people are avoiding seeking medical attention. And it's frightening. It really is absolutely frightening, and there are different ways to get that medical attention. So if you have a need, whether it's an urgent issue or just a little issue you're not quite sure about, at a minimum, call your doctor's office, because they can certainly do televisits. And many of us have done that, you know, whether it's on a tablet or your phone, you are FaceTiming, or like right now, like Zoom, you are video conferencing with your physician. You're talking through the symptoms, if it means looking at a body part to see what it looks like, they look at it. And you're having that face-to-face connection with them for them to give you medical advice. If you need to go to a physician's office or the ER or urgent care, and again, Christine's going to drill more into some of the details of infection control, but offices are doing everything they can to also lessen the risk. Your appointments are made over the phone or online. You don't go sit and wait in a waiting room anymore. You sit in your car until it's time for the appointment. You're checking in online. I've had a couple appointments and I checked in on my app when I got to the parking lot, and then I was allowed to enter the office 3 minutes before my appointment time. They immediately took me back to a room. They were all wearing protective equipment. I was wearing a mask. And all the treatment rooms were labeled in terms of clean or needs to be cleaned outside. So they were sanitizing in between patients. And I felt very comfortable doing that. They were following precautions. They were wearing the appropriate mask. They were wearing goggles or face shields. They were wearing the appropriate attire. So I just passionately need to tell everybody, please do not avoid seeking medical attention, because there are very safe ways to do it, okay? But in terms of general mitigation, when we talk about social distancing, it's not just a matter of who we see, but you know, where have they been? You might think that, you know, your cousin Joe is a really good guy and he's really only staying at home, but maybe your cousin Joe saw someone who had been at the shore for the week. You know, you need to be careful about asking, where have you been? Have you been traveling? Who have you been with? You know, I think all of us know people that have gone to that backyard graduation party or something like that and have gotten sick, even though they thought that they were at a distance. So this is a time for us to continue to be careful and ask those questions. So when you're going out and about, do you really need to go out? You know, we know that some of the mitigating efforts are ordering your groceries online, driving up in front and having them load them in your car. You know, Amazon's doing great. I don't know if anybody has Amazon stock, but they're going hugely. So there's ways to order things, to buy things and lessen it. There are ways to seek medical attention and lessen it. There are ways to get your favorite takeout and minimize the risk. You know, gyms have opened up. Many of us are like, oh, that gym membership might get canceled because, no offense, I know what I've done, but I don't know what everybody else has done to keep themselves safe and healthy and minimize their risk. If you're going to go to the hair salon or the nail salon, again, a lot of them are being very careful. They're checking your temperature when you walk in. They're making you wash your hands as soon as you walk in. They're limiting the number of people, and hair salons are putting like shower curtains up in between people. So there is a lot out there in the community for some of the activities that feel a little more normal to us. And again, the other things in terms of travel. Remember that just because we're in Pennsylvania, all of Pennsylvania is not necessarily good to travel to. Right now in Montgomery County, our incidence of COVID has been fairly flat. You could drive 45 minutes from here and it's a hotbed. So, you know, don't just think because in your little corner of Pennsylvania, everything's fine, that it's fine everywhere else. You know, just the other things I want to mention, again, we've talked about travel, we've talked about medical appointments, we've talked about being careful with who you're interacting with and who you're going to see socially. Don't be afraid to ask those questions. Don't be afraid to wear your mask if you're going to someone's house, even if you're sitting in the backyard. okay? We've talked about medical appointments, and I'm going to turn things over to Christine, but I do want to make one comment about hand sanitizers. Hand sanitizers have been widely touted, lots of different companies ranging from, there's a distillery in Telford that normally makes, I think, vodka, and now they're manufacturing hand sanitizer. There's a lot in the media recently that some of the hand sanitizers can be actually quite toxic. So please, if you have hand sanitizer at home, look at the bottle and make sure it does not include methanol. That's one of the ingredients that's really felt to be really quite harmful. The list of hand sanitizers that are considered recalled is growing, but at a minimum, make sure you don't have a hand sanitizer with methanol, because that could be very dangerous. So those are the main points I wanted to make in terms of community mitigation. And again, we certainly can all answer questions as we go along, but I'm going to turn this over to Christine to follow up in some closer in-person detail.
Alrighty. So I'm going to start by talking about hand washing. So it is so important to wash your hands. It's one of the most important things you can do besides wearing a mask. And you need to wash your hands for at least 20 seconds. Most people don't wash their hands long enough. And if you go to church with us, you've seen me not take communion, and I'm sorry. That is one of the reasons that I don't. I've seen people not wash their hands, and we're doing intinction and sharing that cup, and I'm sorry, unfortunately, it turns my stomach, so I can't do it. So, but you need to be singing happy birthday to yourself, washing your hands, making sure you're getting all the surfaces of your hands, and doing it for at least 20 seconds. So you sing happy birthday to yourself twice. You should be washing your hands before you put on your mask. And your mask should be covering your nose and your mouth. And then you should not be touching your mask, pulling your mask down, because this is the contaminated surface of your mask. That is another way that you can catch COVID, because this is dirty. So you cannot be touching that. You can't be pulling it down. And I actually recommend washing before you actually touch the mask to take it off, if it's a reusable, and then washing after you take the mask off too. And then actually be washing the mask too in the washing machine to try to kill any germs that could be on the outside of the mask. That is so important. I've seen people wear them like this. That does you no good. Surprisingly enough, this is attached to your lungs, and that's where COVID is going, and that is where it is destroying your lungs, and you cannot breathe. So please, please, please wear your mask properly. It's one of the things you can do to protect not just yourself, but everybody else that you are coming in contact with. That is why it's so important. The other thing that we've already touched on is getting your vaccinations. We have seen people now getting whooping cough because they have not gotten themselves vaccinated. We have seen people who swear by not getting the flu vaccines because they think that they have gotten the flu from the vaccination. That is not the case. You don't get the flu from a flu vaccination. Actually, through all this research and everything, I don't know how many of you guys are aware, but there actually is an influenza C that we don't even talk about, that we don't vaccinate for. So you could actually have an influenza C that is going around the community and making people sick that you don't get a vaccination for. So that's something else to consider too, that's a different strain of influenza that could be going around the community that people are getting, and that is making them sick. Also, you could already have influenza before you go and get your vaccination. So that is something else that you can think about before you turn down that next flu shot. And please don't, because we need to reach herd immunity. Herd immunity is very important. That means that a number of people in the community have immunity to a certain virus so that they're not spreading it around. And that's why we've seen this upsurgence of vaccine or of illnesses that we thought that we had conquered, but have not, because we have people who don't vaccinate. So please, please, please do that. There are certain sects of people that can't get vaccinated. If you know our family, our Wesley has an allergy to eggs. So he has been a poor candidate for the flu vaccine. At least for the past 2 years, we've actually opted to give him the mist instead. He hasn't had such a bad reaction to that, but they had just developed a new flu vaccine that is not grown in eggs, which is huge news for our family. It's been FDA approved for 4 and up. So that's another avenue that people can try if they have had a bad reaction to a flu vaccine in the past, which he actually did. I think it was about 2 or 3 years ago. So those are all things that you need to be discussing with your physician about getting these different vaccines. If there are ones that are not grown in eggs, if you have a specific allergy. Sometimes people are allergic to some of the preservatives that are also in the vaccinations. But that's all things that you should be discussing with your physician if it's right for you and best for you. But in general, to keep the whole population safe, the best thing to do is to get your vaccines. And like most people have already said, usually the worst thing is you have a sore arm, but if you do get ill, usually it's not as severe as if you hadn't gotten vaccinated at all. And we're not sure if and when a COVID vaccine becomes available, how often that you might have to get vaccinated. You might have to get vaccinated more than once with this vaccine, or how many strains that we're going to be trying to combat with this vaccine too. So those are all things that we need to think about. Social distancing is still very important to do. I understand that we are in Montgomery County, we're in the green phase, that we have opened up businesses and everything like that. But if you can stay home, that's the best thing that you can do, because staying home means staying safe still. And some of the ways that we transmit this disease this is why it's so important to wear a mask, because the mask is going to cover your nose and mouth. And when you touch it, you can have a vector transmission of the COVID material. So we need to keep 6 feet away from people. They have done studies that have measured how far the droplets that when you cough or sneeze come out can travel. The further away, the better, though. I have read some recent studies that have said that as it gets colder, so in meat packing plants and such, that the virus was actually able to travel farther, which was a big concern for people who work in those kind of environments and have been essential and have been making our food that we eat. And it's very important also to consider, if you feel sick, please, please don't go out. There are so many other avenues. Telehealth. You can also use, like we said, food services to have other people bring you food in. But please don't go out. And the testing sites are great, but they're going to require that you make an appointment most often than not before you go and get tested. So the best thing you can do is, if you're feeling sick, stay home, call your doctor, and try to get on the list to get tested. They have a whole method for that. I was actually tested about a month ago. So what I did was I actually went through my work, my employer, because of where I work. So I called them, gave them my symptoms. I had actually had an exposure to a patient, and then they discussed my options. I got tested. Our tests at Abington, we have two different types of tests. We have a rapid test, which we've found that is not 100% accurate, because nothing 100% is. And that's our rapid Abbott test. That's the one that goes down the nose and kind of tickles your throat. And then we have the hologic test, which is our longer test that is a little bit more accurate, and that they just do in the throat. So, and then our test turnaround time can range, just like Ed said, that anywhere from a couple hours to a couple days to get results. And in that time, you should not go to work. You should not go to school. You should not do anything but stay home unless you need to go to an emergency room. So if your symptoms become so severe that you have chest pain, shortness of breath, anything that would preclude you from, being here with us later on, please seek the emergency room then. But otherwise, if you are able to stay home, the best thing you can do is stay home. I'm going to turn it back, I guess, to Abby.
Thanks so
Yep.
much, Christine.
Thank you very much. One quick word about hand sanitizers, in addition to the potential toxicity of some of them. They only work if you rub them completely dry, okay? And I don't mean flapping them, and I don't mean blowing on them. I mean friction and helping them to dry, okay? So that's just another little FYI. The other thing that we need to guard against too is complacency. And I know it's been for me. I was religious, excuse the pun, about sanitizing surfaces. My husband will attest to that. He would look at me like I had 6 heads. But over time, I have gotten less rigorous about what I'm doing. So this tonight has recommitted me to what I need to do to keep my immediate community safe. Okay, so we all need to help each other there. Okay, that's the hope in this. We are all in this together, whether we realize it or not. Okay. Now we're getting ready for some questions. There's
Well, I got some.
Okay, good. Good. Lorelei, how will we do this? Will they just come up live and you'll move to them?
Yep. So I think that one of the best things right now is for us, if people could there's a couple of questions in the chat that I want to start with.
Okay.
And let's kind of handle them. I'll do my best to kind of spotlight who's ever speaking. And then perhaps when I turn to you, if you could wave your hand and unmute your microphone. I see John Caterlinus has some. Okay, so Abby, I'm gonna put it back, spotlighted on you, and you can tell me who to turn to.
Okay.
Kim Swalje shared that her doctor has encouraged her to get a shingles vaccine because she felt that because the doctor felt that it might be helpful then in helping her body fight off COVID. Is this in fact true? And a shout out to Ed for his Princess Bride quote. But
we love that movie. That's such a good movie. And Miss Gail introduced it to my son. So thank you, Miss Gail.
Mm-hmm.
I'm gonna say I can answer this question. I think that is very sound advice. First thing, Kim, you did the right thing in having that discussion with your physician. What you want to do, and it's under the proviso, is we want to keep our body as healthy as we possibly can over things that we can manage. The shingles vaccine, and Ed could probably speak to this better than I'll defer to him in a couple seconds, but getting that shingles vaccine, this is a very stressful time. That is when the zoster virus will rear its ugly head and you will have shingles. You don't need that now, okay? So that would be a reasonable expectation to go ahead and do that. Do any of the other panelists have any other comment they would like to make to that effect?
I see.
Well, the only thing I wanted to say about the shingles vaccine was that, you can correct me, Abby, if I'm wrong, I had the original shingles vaccine, which turned out for an older person wasn't very effective over time. Then they came out with a newer one, which I think is the only one available today. But if people thought that the one they had 7 or 8 years ago was sufficient, I would question that.
And that's a very good point. Now there is a new zoster vaccine. It requires 2 injections. I had the original one and I will be getting the new one. As we age, our immune system does not respond as efficiently as it did when we were young. And so they have found that over time, viruses will mutate, they will do different things, and our immune system as we age is not able to be that agile. So I'm assuming that's why, Kim, you had that conversation with your physician, and I don't see anything wrong with what they've advised you to do.
Thank you so much, Abby. Abby, there's another question that came from someone saying that they're scheduled for carpal tunnel surgery, sorry, my mouth, and is really extremely anxious about actually being tested. How much discomfort or pain should this person expect? Is there any chance that there's an alternative to the nasal swab in preparation for that surgery?
Deb?
Abby, let me field this one, because I had a small procedure myself last week, and last Monday had to have have COVID test. So when I did the COVID test, it was in Radnor at U of P, and it was the nasal swab. It was not horrible. It was not brain surgery. Honestly, the way they described it to me as I pulled my car up was, you know, it's going to be a little irritating. You may feel your eyes water. You may feel like you're going to sneeze or want to cough. And really, that's the way I would describe it. It was not like getting an injection. It was not like a bee sting. It was more, you know, I don't know if I can compare it to a dental appointment, but it was more like just an irritation inside my nose. The swabs are now not going back quite as deep as they used to, so they're not as irritating. But for me, it was a little bit irritating. It lasted a couple seconds where I was like, "Ooh, I don't like this," and I feel like I need to sneeze. And but it was to the count of 15 in each nostril, and then that was over. So the test itself was not horrible. I did have to have a small procedure done. Everything was very, very careful about how they handled it in terms of infection control, what I had to do before and afterwards. So I'm sure that whomever's having this surgery, the precautions, they're going to be very, very careful. And please understand that any of us that work in healthcare, we're checking our temperatures every day before we go to work. And many, you know, I have to check mine at home, but most of us are getting our temperature checked when we get to work. We're constantly monitoring our symptoms, and we're constantly monitoring to see, like Christine said, she got tested because she came in contact with a patient. So your healthcare providers are taking precautions, but please don't be afraid of the test. It's not that bad.
Thanks so much, Deb.
And just to follow up, Deb, with that, you can be empowered as a consumer to ask a healthcare professional, can you wash your hands? I would like to see you do that. Are you going to put a mask on? You know, you may get a little pushback. You may get somebody looking at you like you have 6 heads, but hey, it's your body. You're the final gatekeeper. So you can do that.
I honestly am going to follow up on that too, because working in home health, and I am mostly in management, but I had to see a patient at home. And when I approached, I had my goggles on and my mask on and everything. And the family member said, would you please put these booties on your feet and put a gown on? And I said, absolutely. So your healthcare provider is going to do what you need to do to make sure you feel comfortable and safe.
Thank you so much, Deb. John, I believe you said you had a question. Just give me 1 second.
I have. I'm sorry.
He has them for Ed.
Yes.
So bring Ed up.
Okay. You want to go ahead? Why don't you speak to those questions and then I'll bring Ed up.
Okay. Well, I just wanted to make a brief comment that hand washing. Since I don't have any medical or pharmacological training, I remember reading this very simple explanation of why it's important to hand washing that has stuck in my brain all these many months. And basically it says that the SARS-CoV-2 virus is not a living organism. It's a protein molecule, RNA, and it's very fragile because it's only protected by this thin layer of fat. So this is why when you use soap and water for 20 seconds, it basically kills it.
Right.
So that has stuck with me a long time. But my questions to Ed are, when he talked about the antibody test, he kind of alluded to, but I don't think really particularly said that the protection level that comes as a result of the antibody test is sufficient to protect you from getting it again. And I assume that's true, right?
Go ahead, Ed. You're on. Oh, and you're muted though.
Unmute. I'm
There you
unmuted.
You're good now.
I'm good. Okay. A couple things. Ideally, if we have the antibodies, we should have the protection. And we're going to go with that at the moment. There's been a few reports of people who had tested positive with an antibody test, and then came down with symptoms of COVID. Now, the problem there is we had the antibodies. We knew you had some contact with it, apparently not enough that you were young and healthy enough that, you know, you blew it off as a cold. But then you came down with the disease or the actual worst symptoms. So we're not totally sure yet if that antibody test and that antibody level is going to give us ideal protection.
Okay.
So far, so good. When we look at the number of people with positive antibody tests and the number of those people that have become, let's say, reinfected, the numbers are minuscule, if at all.
Right.
But I don't think anybody's going to step out right now and make that statement saying, you know, once we have the antibodies, we're good to go. With that said, too, a couple other quick little notes that I just jotted down. Good notes, bad notes, and some we're even just looking into the future. The vaccines that are being looked at right now are adult vaccines.
Good.
Okay, yeah, good. 18 and above. Why 18 and above? Well, if I'm going to go to a phase 3 study and I'm going to say I need 30,000 6-year-old kids, I'm not going to have a lot of parents step up. So it's going to be a while before we come up with a child's version of this. So we need to be able to protect our youngsters. And that's going to be an important fact to go into there. Other things to look into the future. Yes, they have actually tossed over the fact that, and Christine and a couple of people have touched on this, we may not know if this is a one and done deal. This COVID might be a type of a flu vaccine where it's going to sit there and say, you want to know something? I think it's time for me to make a change. And boom, we're right back to square one and having a whole bunch of people break out with this. They have already discussed whether or not they can incorporate a COVID vaccine with a flu vaccine and make it a yearly situation. The flu vaccine, as Christine has hinted to, it is a guess. We look at what's happening worldwide and sort of put it together. So sometimes we hit it, sometimes we don't. There is a ton of research being done on flu vaccines right now. I'm not going to go into it, but if you're interested, you can just drop me a note and I can tell you more on it. But yes, this may be a yearly situation where when we go into our doctor's office or into that pharmacy, that vaccine we're getting is going to be a flu/COVID vaccine. We'll let the experts take the steps and see what's going on, and hopefully the research goes on to there. John, also in regards to your shingles shot, and anybody else has got it. I myself have gotten the first one, the Zostavax, when it came out there. It is believed to be and has shown effectiveness. Now, whether or not it's as effective in our senior population, time will tell. The fact that we've gotten a newer, better, more improved model says, if given the opportunity, get it. If you have not had chickenpox as a child, or can't remember you had chickenpox as a child, yes, shingle shots should be gotten, because to tell you the truth, chickenpox is a way of getting out of a couple days of school when you're a child, but as an adult, it is a painful, aggravating situation that is so easy to avoid with a simple vaccine.
Yeah, just like on that question, my wife always swear that she never had chickenpox, and I would question this with her, from time to time. No, never had it, never had it, and finally convinced her to go to the doctors, and they took a test. She had the antibodies, so
Yep.
She did experience it, even though maybe she didn't get sick or doesn't remember getting sick. She had
Right.
it.
Which brings us to another point that you have brought up there about the virus. The virus itself is I don't want to say useless, because it's really big of a pain. The virus needs to combine to cells in the body for it to do its work. So yes, we can destroy viruses on topical surfaces with disinfectants and so on down the line. Once it's in the body and it connects to what we need to connect to, or what it needs to connect to, and we've all seen that colored picture of the COVID molecule. It's like, I think, the front cover of every magazine that's been out there. That's when it's going to do its harm. So that good hand washing, that fact that we're not going to touch the face, we're not going to let it get into us to do what needs to be done. But with that said, there are a lot of situations that we run into, and that's why we see a lot of these vaccines that require 2 shots, is the fact that our body sees something at times that is foreign to it, but does not necessarily consider it a problem at the moment. It doesn't like it, but it's not going to react, badly to it. It's that second time it comes in contact with it that now it says, oh, I saw you once before. I didn't like you then. I definitely don't like you now. And I've actually gotten something prepared to keep you from bugging me. So yes, we have had, there are probably hundreds of millions of children who have in their lifetime come in contact with somebody with chickenpox, and their body just said, you want to know something? You're not a high enough level in my body to cause me aggravation. I'm going to remember you, but I'm not going to react to you at the moment. So that's why we get that antibody production going on to there.
So I have one further question, and this is a question that's going to stump you, and I don't expect you. I don't expect you to know the answer to this, really. So when we get to phase 4, as you called it, right, when it's being distributed to all of us, the question is, and I assume this has to filter down from the federal government to the state government to the local governments. The question is, who goes first, quote unquote? I'm 65 and older with pre-existing conditions. I want to go first, but I know that's not necessarily fair. So have you heard anything as far as how the government is starting to put together how they're going to deal with this? once these millions of doses are available?
If they go with a standard playbook, okay, it's going to be first responders, i.e. healthcare professionals who are going to come in contact with this. And, that's going to trickle down to, EMTs, paramedics, police officers, those people that are going to have that first contact possibly with somebody with this. Then you're into the next category, people that have other existing conditions that this could really be bad for them. That's the next level down. Then we get down to, people who are just out there and may come in contact with it and whatever it may be. So this is going to have a pecking order established by that playbook of recommendations, but also we're going to have what they call a gatekeeper situation. Your insurance companies and other healthcare groupings are going to sit there and say, okay, John Smith is a 32-year-old in great health. He does not need to get this shot. So he could request it. He could pay for it out of his pocket. But we're not going to voluntarily give it to him until we know everybody else is covered. The other thing is with this playbook, it's going to go to hot spots first. So areas that are showing spikes when this vaccine becomes available, they're going to get it before other places get it. It's going to be a little bit of chaos. There's going to be a lot of people saying, I want it, and I want it now, because right now we have people saying, I want it, and I want it now. And you're going to hear news stories of people traveling to all types of countries saying, I just got the coronavirus, vaccine in Guadalajara. I hope it was, but, it is fearful.
So, so from your perspective, knowing what you know about what they're developing, the vaccine that is, do you feel that when we get this shot, whether it's one shot or two shots or a booster shot, whatever, do you feel that we can go about life nonchalantly, living our normal life like we do when we get the normal flu shot in October? We don't think about, in fact, I've never known anybody that ever has died of the influenza. I mean, they say there's 20 to 30 million people a year that die. I've never heard of it, known anybody that's ever died of the flu. But I'm wondering, do we have to treat this a little more carefully, even if we get the shot? What do you think?
I think in this day and age, and what we're going through right now, we're going to walk into a change in our social behavior overall. Masks are going to become a standard. And to tell you the truth, we're catching up. In the United States, we're catching up. I mean, you look at pictures from Asian countries, and you'll see a ton of people walking around with masks on. Okay, they sort of knew it ahead of time, saying, okay, I got a little bit of a cough, I got a little bit of a sneeze, I'm going to wear my mask so that I don't give it to somebody else. We are those people with like, well, no, that's okay. I'll just cough into here and, whatever it may be. We're now in that social learning curve. So we need to stay on top of that. It does mean that there's going to be a lot of changes that we're going to have to go through. There's a ton of people I would have loved to shake hands with over the last couple of months, but I haven't shook anybody's hand in a long time. It needs that little extra ounce of protection. And
things are not going back to normal, even if I get the shot.
You got it. It's going to be, we're on the right path. We're in the right direction. But, you know, you let your guard down too much, and you know, somebody else is going to crawl in that door, and we're going to have a pandemic of who knows what.
Right.
And as you know, Christine mentioned, Sue mentioned, you know, we're already seeing it. You've seen it over the last decade where colleges have had outbreaks of measles, and the level of whooping cough. I mean, my biggest shock was when I left full-time pharmacy was the number of mumps cases that I saw. I'm like, mumps? I mean, that is like a 6-month-old, you got your shot, whatever it may be. But, you know, we have to be more aware of those little germy things, because they're going to get us. H.G. Wells wrote it in his War of the Worlds, man. You know, got to be careful about those viruses. We might be greatly immune, you know, and have all our protection, but there's going to be that whole group that's going to come down here and really suffer from it.
Thanks, Ed. I'll be quiet now.
So Ed, this is Lorelei, and
Yes.
This could be for anybody, really, but I guess that brings up a couple of questions for me. One that I was thinking of was that the flu shot has a certain degree of efficacy for a certain length of time. And so in previous years, I feel like it was maybe said that if you got it a little bit later in the season, that helps you a little bit further into February or March. I don't know if I'm kind of making that up, but, or is this a case that this year would be wise to get it when it comes out? And, you know,
CDC recommends the minute it becomes available, which should be within the next, we're into August, within the next 3 weeks, 2 to 3 weeks. When it becomes available, get it.
okay.
Especially if you do get a shot every year. These shots are now containing 4 strains of the viruses that we think are going to cause it, and they're dead. You know, they're dead, Jim. And it's going to bring on a response. The fact that one of them is always a repeat from the year before means we're already going to get a response. I've had people come back and say, you know what, I got my shot. Thank you very much. It went really well. But the next day it felt warm. It's like, that's perfect.
Good.
Okay. That means your body saw something it didn't like, and it is already sitting there saying, I don't like you. I'm prepared for you. I'm ready for you. There is research out there. There's a study that's been going on for 10 years on a super vaccine. There are studies going on right now, which I have referred to with my students, what I call a base model vaccine.
Are you talking about the adult dose?
Well, the adult, even 65 and over, which, you know, they got a little bit stronger strain there. That's fine. I don't feel my immune system is that old, but then again, I'm older and I don't believe a lot of things anymore. But what they're looking at is the fact that you'll see that this is you hear like H1N1 or whatever it may be. As I explained to my students, when you walk into that car showroom and you're looking at that Ford Mustang with the chrome wheels and the darked out windows and the fancy 302 engine and whatever, but I want to buy a Mustang. Oh yeah, that's in the back there. That's the one with the pleather and the white wheel covers and whatever. The vaccine is being developed to, or being studied to do these basics, or a base model. So I'm getting that vaccine for that Mustang. It may take an extra day or so for it to realize that what you just inhaled was that one with the chrome rims and the blacked out windows and everything. But it will realize that you are still a Mustang. So you're going to have some immunity. You may be somewhat sick. You may catch a bit of a sniffle. You may feel a little run down. But compared to that whole flu symptoms, and I have to agree with Sue, the one time I had flu, the first day when it really hit me hard, you know, I don't even remember much of that day. So we got things to get and things to protect.
Mhm. And I guess also as a parent of school-age children, and maybe this is Christina and Deb can kind of speak to this too, but I think my assumption was that because I have to fill out all of that paperwork at the beginning of the school year and related to vaccines, that I thought that actually meant that they were required by school districts. So the entry into the school district, I thought it meant that the school districts kind of required them. And Abby said something the other day that kind of led me down thinking that, that's not necessarily true. And I guess it was in my head that you said that frontline workers, would be the first ones that it's available to. Is it required of your employment in certain places to have them? I think that just
Yes.
kind of speaks to
Yes.
some assumptions.
So,
that we have that,
if you want to stay employed, you're going to have the flu vaccine as an example.
Or you can get a religious exemption. So there are people that don't get it because they get exempt from having it.
okay.
Because just like Wes, like I said, he's allergic. There are people that are working in healthcare that could have an allergy to it, or they don't feel that it's right for them. So
Right.
there
So
are people that don't get it.
exemptions.
And
There are some
I had a
exemptions.
student that fit into that category, a college student, and we were doing clinical in a long-term care nursing home facility. And she had an immune deficiency. And so she had to present documentation, and she had to wear a mask the entire clinical shift, no matter what. So those folks that have had to do that, this is one way that we mitigate our community to be as safe for all.
Right.
And that's just kind of what we need to do now as part of our role in managing COVID instead of it managing us.
Right.
So Deb and Christine, I know have been waiting to speak.
Deb, you understand?
I do. I just want to follow up related to influenza and deaths. One of my best friends lost her toddler to the influenza years ago. So it can be young people, it can be older people. I think the challenge is influenza deaths haven't been reported like box office scores on the evening news. We may see that change this year, that they may start saying, hey, in Montgomery County, Pennsylvania, we have 200 more influenza diagnoses today. And by the way, 4 people died. So people are, and I think part of it is because the influenza deaths were certainly less than the COVID deaths to date, and they were a little more spread out. It hasn't tended to be as virulent, but people can absolutely die very much so from any age range from influenza. It is very, very serious.
Are there any other questions, comments? I know you've really held in there. We're kind of going on about 90 minutes. So I know your brain is probably super saturated right now.
And I miss Father Brown.
We
Abby,
just
can
want
I-
to thank everybody for your time and attention. And hopefully you've been able to glean at least a little bit of something to take away from this experience. All of us have emails that we could answer questions. Moving forward, there may need to be other ways that we communicate with you all. But just stay vigilant, wash your hands, wear your masks. And thank you for your time.
I think I
Stay
saw
well.
Sue.
God bless.
Sue, were you going to say something too?
No, I just wanted to kind of quick follow up because I heard myself say, I just got back from vacation, and that sounded a little contradictory, of course, with the information of this seminar. But I did want to say that we have a travel trailer and we were in a remote area and it was just us and we didn't come into contact with anybody, and it was just a weekend or so. So I wanted to reiterate that I am following the recommendations and not just going around on vacation.
Well, I think that it is important to remember, and maybe working with you guys. Wait, hold on a second. I'm having a hard time here. That it is safe for us to talk about and what we can do in this time, and not just all of the things that we can't do. And so, I think that being able to remember how we can manage risk, and what possibilities there are that are less risky is just as important, because I think even though we haven't spent much time talking about mental health, as a pastor, one of the things that matters to me a lot is thinking about spiritual health and mental and emotional health. And just in a conversation with someone the other day, who actually works in the ER at Abington, has said that they are seeing coming through the Abington ER a significant number of now mental health issues, including young people as young as 9 years old and in their teens that are engaging in self-harm because of the social difficulties and stresses of all that. I mean, a 9-year-old, a 12-year-old, and self-harm. And so I think that as Gail and I have spent a lot of time talking about, if Gail's still on, she knows what I'm talking about, but like, how do we very creatively remember what opportunities we do still have, and how we can find joy and make music and celebrate life in ways that are safe. So there we go. Thank you so much, all of you, for your time. Does anybody else want to just sign off, or are we in a good way?
I'd like to say something. Can you hear me?
Kathy Genzel's here.
I'm a retired school nurse. I worked for Neshaminy for many years, covered 2 elementary schools, and this was very well done. I appreciate the input from the professionals, and I'm glad somebody clarified that people do indeed die of influenza. But thanks, it was nice to be a part of this and listening.
Thank you so much. I'm glad you could be with us, Kathy.
Yeah, thank you.
You're welcome. All right, does anybody else want to wave? Is anybody? Oh, I see Craig. Craig,
I need some clarification.
go for it.
I understand that someone, when they're asymptomatic or in the early stages of having it, that they are contagious. But what about when they're with antibodies? What's the line here? How's that going? Anybody want to grab that one?
Like, how long does a person remain contagious? Is that what you're saying? Or
basically, yes. I mean, if the guy comes in, I self-quarantine, I feel pretty good, 14 days, blah, blah, blah. But he's back, and is he not contagious?
So you're talking about even maybe potentially with clarification about persons re-entering the workforce?
Correct.
Okay.
Usually, if they have antibodies, that means it's been in their system long enough that the body has reacted to it. And if anything, each day that goes by, they are probably less and less and less contagious. The scary part, and this is also with chickenpox, we love the fact that we've taken these children who all of a sudden have chickenpox and take them out of school for a while so the little sores can heal and everything. They were contagious for days before the first one of those popped. Right. So yes, that person with COVID right now is contagious a lot of times with being asymptomatic until those antibodies pick up. That's why that mask is important. You'll see posters where, one person wearing that mask decreases our chances by, say, 30%. 2 people wearing that mask decreases it by like 90%. That is why it's important that we need to change the culture around and make those masks part of our daily lives now.
And just to
That
follow,
kind of,
I
may
just
I?
want, go ahead, go ahead.
Okay.
What is the new normal? What is Christmas going to look like? What is next, say, the start of the school year next year going to look like? Are we going to come to an equilibrium with this thing? Or, you know, or are we stuck with fear? I guess it comes down to.
Craig, I want to back up to the last question for a second. When people are symptomatic versus asymptomatic, if people are symptomatic, then there are guidelines in terms of how long they've been without a fever, for example. But
Right.
many workplaces require that once somebody has no symptoms, they have to have 2 consecutive non-positive tests.
And those
So-
tests would be the viral agent.
Correct.
Right.
That's many workplaces require 2 tests that are done that are both they're neither one of them are positive. And so it's not necessarily testing the antibodies, but it's testing for the positivity of the virus.
Right.
So that is one of the components of it. But in terms of your question about what is Christmas going to look like, it's probably going to look like this until we have herd immunity and we have the vaccinations out there.
And people are getting it. And
better
it's going to take time.
I better really enjoy Zoom because that's the only way I'm going to see your smiles.
So Craig, though, I mean, I hear that question maybe also coming out of experience, right? And I don't know how many other people are on this call or might end up watching this later down the road. But I mean, all of us work in very different settings. And while that is a recommended, like what I hear you saying, Deb, that's a recommended, that you would have 2 negative tests. You know, if you're in a much smaller business, that may or may not be the case. So, I mean, along with that, would you also then say we should encourage asking educated questions of our employers about what are their requirements before they let people come back? Because I think what I hear Craig saying is he's maybe not certain if that kind of thing is actually in place and if it's being mandated potentially, you know, by his employer. I mean, I'm not trying to assume anything about your employer, but I think I'm just trying to play out that scenario a little bit more, that we should feel empowered to ask questions about how will we quarantine people, or how will we allow reentry back into the community's employment.
I think it's talking to employers and also talking to your own primary doctor.
Mm-hmm.
You know, what are they recommending?
Mm-hmm.
Thank you.
Yep. Anybody else have any questions out there?
Well, my final comment is, and I just kind of directed to Ed again, is that really, until medical science can really uncover the enormity of this particular virus, some of these questions that were raised and were tried to answer really can't be answered. It's going to take time. Time, I think we're talking about, is years, not months.
Mm-hmm.
We're sticking our finger into the dike and hoping that the next little leak is close enough to my other hand that I could stick my other finger into that one. But we know sooner or later that whole dike is going to come down. It's terrible to say, but in a lot of parts of healthcare, that's the way it is. And with nature being what nature is, we're going to come close to solving one issue, and there'll be another one popping up. I've always believed that, you know, God is got a great, you know, laughter behind him, her, it, shim. Sit there, says, man, you have now figured out the whole DNA structure. I'll give you that. Now, what are you going to do with it?
Right.
You know, so I'm going to throw this at you. Let's see how you go with it. You're going to solve this one. And when I'm done with that one, I got another one coming around the corner.
I think there's awe in that too, though, and that's part of it. Well, thank you so much to all of you. This has been really incredible. Please remember that all of the people that have been a part of the panel are willing to continue to answer questions and, you know, happy to be a part. I see, Gail, I saw you raise your hand. Gail, did you do that on purpose?
I was clapping.
Oh, you were clapping. Okay. Yes, we can all clap. You can open all your microphones and we can all. But thank you very much. And everyone be safe and stay well.
Thank you.
And let's take this information and be empowered by it so we don't have to live in fear. Thank you and good night, everyone.
Good night.
Good night.